Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Heart Attack or Broken Heart. And trust me, it's juicier than your cousin's peach cobbler. Did you know that extreme emotional stress can literally break your heart and mimic a heart attack? Yep, entirely true. I can't make this stuff up. Today we're uncovering the shocking truth about broken heart syndrome. And folks, this one's going to blow your mind faster than a teenager spending your credit card at the mall. So what exactly is broken heart syndrome? Well, broken heart syndrome, or as we fancy doctors call it, Takotsubo cardiomyopathy, causes your heart's main pumping chamber to suddenly weaken. Now picture this. Your heart literally changes shape when you're hit with intense emotional or physical stress. It starts looking like a Japanese octopus trap, which is where that fancy name comes from. Takotsubo means octopus trap in Japanese. And trust me, your heart feels just as trapped when this happens. Here's the kicker. The symptoms mirror a heart attack perfectly, but when we look at your coronary arteries, they're cleaner than your grandmother's kitchen counter. Your arteries are fine, but your heart muscle is throwing a tantrum like a toddler who missed their nap. But here's what makes this condition so dangerous and why I'm talking about it today. The warning signs are sneaky little devils that you absolutely cannot ignore. We're talking sudden chest pain and shortness of breath that hits you right after getting traumatic news. And ladies, listen up. This happens 90% more often in women, especially after menopause. Sorry guys, the ladies win this unfortunate lottery. This syndrome loves to show up uninvited after life throws you a curveball, death of a loved one, divorce, job loss, or getting smacked with a serious medical diagnosis. And here's the scary part. It can be life-threatening despite being temporary. Your heart doesn't care if it's supposed to get better eventually when it's struggling to pump blood right now. Let me share a real case that illustrates this perfectly, because sometimes you need to see it to believe it. I had a 68-year-old grandmother who got rushed to the ER after learning about her grandson's car accident. This sweet lady had classic heart attack symptoms, chest pain that could stop a freight train, shortness of breath, the whole 9 yards. But when we ran our tests, her arteries were clearer than a mountain stream. Here's where it gets interesting. Her heart's left ventricle had ballooned into that distinctive broken heart shape I mentioned earlier. It was textbook Takotsubo cardiomyopathy. The good news? She made a full recovery within weeks once we addressed the emotional stress and gave her heart time to heal. Her heart literally mended itself once her mind found some peace. So what can you do to protect yourself from having your heart throw this kind of dramatic fit? Stress management is your best friend here. I'm talking meditation, exercise, counseling, whatever helps you keep your stress levels from hitting the roof. And for the love of all that's holy, don't ignore chest pain even during emotional crises. I don't care if you think it's just stress, call for help. The beautiful thing about broken heart syndrome is that most patients recover completely within days to weeks. Your heart is remarkably forgiving, kind of like your dog after you accidentally step on their tail. But support systems are crucial during high-stress life events. Don't try to tough it out alone like some kind of emotional superhero. Now, here's your actionable takeaway, and I want you to write this down or tattoo it somewhere you'll remember it. If you experience chest pain during extreme stress, call 911 immediately. Don't wait, don't debate, don't call your neighbor's cousin who watched a medical show once. Call the professionals. And starting today, practice daily stress reduction techniques. Your heart will thank you more than your wallet thanks compound interest. If you're dealing with chronic stress or have concerns about your heart health, maybe I should see you in the clinic. We need to talk. Don't let stress turn your heart into an octopus trap when we can work together to keep it healthy and happy. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.